Today we're going to cover Chapter 2, Organizations that Help Shape Community and Public Health. These are the objectives for Chapter 2. You can read through them on your own time, as there are quite a lot of them. Throughout this chapter, we're going to cover governmental health agencies, including international, national, state, and local agencies, quasi-governmental health agencies, such as the Red Cross, non-governmental health agencies. This includes voluntary, professional, philanthropic, social, religious, and corporate agencies. Only in the past 100 years have communities taken explicit actions to deal aggressively with health issues continuously. For much of history, communities only met when there were emergencies. For example, if we lived in a very small town, we might only come together as one singular unit when there was a drought or a flood or some other major hindrance. The community response to its own problems are hindered by various issues, so for example, complexity and size. Now that cities and towns are becoming more complex with multiple layers and we're getting bigger, it is more difficult to implement quick changes. The three classifications of agencies are based on funding sources, responsibilities, and organizational structure. Governmental health agencies are part of governmental structure. Therefore, we have them at the federal or national level, state level, and local level. They are funded primarily by tax dollars, and they are managed by government officials. Each of these agencies has authority over some geographic area, and again, they exist at 4 levels: international, national, state, and local. International health agencies. The World Health Organization, also known as the WHO, is the most widely recognized international government health organization. It's headquartered in Geneva, Switzerland, and it has 6 regional offices around the world. These offices are in Africa, Washington, D.C., Egypt, Denmark, India, and Philippines. It's not the oldest World Health-related international agency, but it is the largest. History of the WHO. In 1945, the Charter of the United Nations called for the construction or establishment of a health agency with wide powers. In 1946, the UN representatives created and ratified the Constitution of WHO. In 1948, the Constitution went into full force and WHO began work. So it was approved in 1946 and started in 1948. Membership is open to any nation that has ratified the Constitution and receives majority vote of the World Health Assembly. This includes delegates of member nations. So specific individuals from each country that is already in the WHO approves newcomers. There are 194 member countries, and the WHO is administered by different levels of staff. This is a map of all the countries in the WHO, and you can see that there are only a few outside of it. So for example, we can see right here that Taiwan is not a member. Purpose and work of WHO. The primary objective of the World Health Organization is the attainment of the highest possible level of health by all peoples. Emphasis on all peoples, as this is an international network. It has 6 core functions to achieve objectives. The work is financed by member nations. So member states are assessed according to their ability to pay, and they contribute voluntarily. This voluntary contribution, it makes up 75% of the entire budget. One of the most notable works of the WHO is helping to eradicate smallpox, which we'll talk about in a later slide. It also has work guided by the 12th General Program of Work in the UN's Millennium Declaration. So here are the WHO core functions: providing leadership on matters critical to health and engaging in partnerships where joint action is needed. So this means they focus on critical health matters and they work together when it benefits the situation. shaping the research agenda and stimulating the generation, translation, and dissemination of valuable knowledge. In essence, they're focusing on research, spreading the knowledge learned from research to everybody, setting norms and standards, and promoting and monitoring their implementation, articulating ethical and evidence-based policy options, providing technical support, catalyzing change, and building sustainable institutional capacities, monitoring the health situation and assessing health trends. So in sum, right, they provide leadership, focus on critical health needs, spread knowledge, set standards, and make sure people are meeting those standards, and they monitor health situations. Now we're going to discuss the eradication of smallpox, which is the most notable accomplishment of the WHO. At one time, smallpox was the world's most feared disease until it was eradicated by the collaborative global vaccination program led by the WHO. Emphasis on collaborative, meaning lots of countries work together. The year 2015 marked the 35th anniversary of this eradication. In 1967, smallpox was active in 31 countries. During that year, 10 million to 15 million people contracted the disease, and of those, approximately 2 million people died. Many millions of others were permanently disfigured or blinded. The last known natural case of smallpox was diagnosed on October 26, 1977 in Somalia. In 1978, a laboratory accident in Birmingham, England resulted in one death and a limited outbreak of the acute disease. In 1979, the World Health Assembly declared the global eradication of this disease. Using the smallpox mortality figures from 1967, it can be estimated that more than 60 million lives have been saved since the eradication. Here we have a short news clip celebrating the 35th anniversary. National health agencies. Each nation has a department or agency within its government responsible for protection of health and welfare of its citizens. The U.S.'s primary national health agency is the Department of Health and Human Services, abbreviated HHS. Department of Health and Human Services provides essential human services, especially for those who are least able to help themselves. In essence, it focuses on minority populations, people at risk, and people with low socioeconomic status. Other federal agencies contribute to health, including the Department of Agriculture, the Environmental Protection Agency, the Occupational Safety and Health Administration, and the Department of Homeland Security. This department is headed by Secretary of Health and Human Services. They are appointed to the position by the President of the United States and are a member of their cabinet. Currently, right now, the Secretary is Alex Azar. This department uses 25% of the federal budget and is the largest department in federal government. Typically, their budget includes $1.5 trillion. New healthcare reform laws provide a series of new duties and responsibilities for this department. So as we change our healthcare laws, they are in charge of more and more responsibilities, or at least different responsibilities. And they are organized into 11 operating agencies and 10 regional offices. Other operating agencies of the Department of Health and Human Services include Administration for Community Living, Administration for Children and Families, Agency for Healthcare Research and Quality, Agency for Toxic Substances and Disease Registry, Center for Disease Control and Prevention, Food and Drug Administration, Centers for Medicare and Medicaid Services, Health Resources and Services Administration, Indian Health Services, National Institutes of Health, Substance Abuse and Mental Health Services Administration. State health agencies. All 50 states have their own state health departments. Their purpose is to promote, protect, and maintain the health and welfare of their citizens. These state health agencies are usually headed by a medical director who is appointed by the governor. Purpose represented in core functions of public health: assessment, policy, development, and assurance. Here are the core functions of public health and 10 essential services. You can see that it starts with assessment. Monitor health. So this department is in charge of observing the health of their local area, to diagnose and investigate any issues. They inform, educate, and empower citizens, mobilize community partnerships. They push people together when it's best that they work and collaborate on the issue. They develop policies that are necessary. They enforce these policies and laws. And they link to and provide care. They assure a competent workforce, and then they evaluate the situation. Most state health departments are organized into divisions or bureaus, and they play many different roles. Some can establish health regulations. Some can provide a link between federal and local health agencies. They can serve as conduits for federal funds aimed at local health departments. And some have laboratory services available for local health departments. Local health departments are the responsibility of city or county governments, and the jurisdiction often depends on the size of the population. They provide state-mandated services: restaurants, public buildings, and public transportation inspections, detection and reporting of certain diseases, and collection of vital statistics. There are approximately 2,800 local health departments in the United States. Each local health department, often abbreviated LHD, is headed by a health officer, administrator, or commissioner. We can use these terms interchangeably. Usually, they are a noted physician, dentist, veterinarian, or individual with a master's degree or doctoral degree in public health. If they are not a physician, then a physician is usually hired as a part-time consultant. The health officer and their assistants may recommend programs to be offered by the local health department, but the local board of health must approve it. Board of health members are not required to have any knowledge of health or public health, and they are usually hired based on local politics. This is the typical organization of local health departments. Again, you have the board of health at the top, which leads to the health commissioner. If the health commissioner is not a physician, they typically have an assistant or a part-time physician on hand. And then they have different subsections for environmental health, health education, nursing, vital statistics, chronic disease, and communicable disease. The local health officer has far-reaching powers, including the power to arrest someone who refuses to undergo treatment for a communicable disease, such as tuberculosis, and who thereby continues to spread the disease in the community. Think about the application of this to COVID-19, which is occurring right now. You have people coughing on others intentionally, traveling while positive, etc. These local health officers can arrest them and charge them. This is from the article linked on the previous slide. And this article is about a man who coughed on a Wegmans employee and then was charged with a felony. Now, this man didn't just happen to cough on somebody on accident during COVID, but he was upset about the current situation, coughed on an employee who was wearing a mask and taking precautions, and then claimed that he had tested positive. So he was proclaiming that he had the coronavirus and there coughed on an employee. The local health officer also has the power to close a restaurant on the spot if it has a serious health law violation, or even to impound a shipment of food if it is contaminated. Quasi-governmental health organizations. So in case you don't know, quasi means sort of or kind of. So these are kind of governmental health organizations, meaning that they are in part government and in part not government. So they hold some official health responsibilities, but operate more like a voluntary health organization. They operate independently of government supervision, and they derive some funding and work from the government. Examples include the American Red Cross, National Academy of Sciences, and National Science Foundation. the American Red Cross was founded by Clara Barton in 1881. The official duties of the American Red Cross include to provide relief to victims of natural disasters and to serve as a liaison between members of armed forces and their families during emergencies. Their non-governmental services include blood drives, other safety services such as CPR and first aid training, water safety, and HIV/AIDS instruction. Community volunteer services, including nursing, youth, and volunteer health services, and also international services. They are a part of international movements. Other quasi-governmental organizations include the National Science Foundation, which focuses on the funding and promotion of scientific research and the development of individual scientists. The National Academy of Sciences acts as an advisor to the government on the question of science and technology, and members include some of America's most renowned scientists. Although neither of these agencies exist specifically to address health problems, both fund projects, publish reports, and take public stands on health-related issues. Non-governmental health agencies are funded by private donations or membership dues. They arose specifically due to a specific unmet health need. They operate free from governmental interference, and they meet specific IRS guidelines with their tax status. And there are also many types of non-governmental agencies, including voluntary, professional, religious, social, philanthropic, corporate, or service. These were created by one or more concerned citizens that felt a specific health need was not being met by governmental agencies. Most exist at a national, state, and local level. National often focused on research, state links national with local offices, and local often carry out programming. Usually it's a combination of paid staff and volunteers. There are 4 basic objectives to voluntary health agencies: to raise money to fund programs and research, provide education to professionals and to the public, provide services to those afflicted, and to advocate, to increase awareness of the issue. Fundraising is a primary activity because it funds research and helps push for policy change. Examples of these agencies include the American Cancer Society, the American Heart Association, and the March of Dimes. March of Dimes helps mothers and infants. Professional health organizations. These are made up of health professionals who have completed specialized training and have met standards of registration or certification or licensure for their fields. So not anybody can join these organizations. You have to be a member of that specific community. So for example, I am a certified health education specialist, but in order to do that, I had to demonstrate that I had a master's in the relevant field. You can't just take not anybody can just take the test. So the mission of these organizations is to promote high standards of professional practice. They are funded primarily by membership dues, which you have to pay annually. And some examples include the American Medical Association and the American Public Health Association. Most of these provide similar services to their members. They offer certifications of continuing education programs for professional renewal. So when you hold a specific license or certification, every year or every few years, you have to complete a certain amount of continuing education credits. And these are when you complete workshops or go to conferences where you're learning more about what's happening with research. So every year I have to take a certain amount of classes that demonstrate that I'm learning more and keeping up to date with health education. So usually they host an annual convention where members share research results and interact with colleagues. They often have publication in professional journals and other reports, including the Journal of American Medical Association, JAMA, and the American Journal of Public Health and Health Promotion Practice. Philanthropic foundations. They are endowed institutions that donate money for the good of humankind. The fund programs and research on prevention, control, and treatment of many diseases. Some have very broad support and others are very specific. Some examples include the Bill and Melinda Gates Foundation, the Commonwealth Fund, and the Robert Wood Johnson Foundation, or local community foundations. Service, social, and religious organizations. Many of these do not have health as a primary mission, but make significant health-related contributions. Contributions of religious groups to community health can be substantial. There's a history of volunteerism, influence on families, donation of space, and sponsorship of programs such as food banks and shelters. Corporate involvement in community health. The biggest role is provision of healthcare benefits. Worksite health promotion programs aimed at lowering healthcare costs and reducing absenteeism. They focus on safety, counseling, education courses, and physical fitness centers. So corporate health is becoming really popular because we're finding out that healthcare and insurance companies benefit when workers are healthier, right? So from the business level, if I have a whole bunch of healthy employees, they're likely to come to work every day. So they're less likely to be sick, less likely to take time off, right? And they're more likely to be productive. And insurance is working with corporate agencies because they also save money, right? If I am healthy, then I save insurance agencies a lot of money. So corporate health is becoming extremely popular right now. So here are just some discussion questions to end the lecture with. How have voluntary health organizations impacted health outcomes? How does the Department of Health and Human Services impact individuals? And how can the World Health Organization overcome the obstacles they face?